Good evening to our listeners and viewers, and welcome once again to yet another one of SAOPA's health, literacy, and psychosocial virtual sessions. My name is Dr. Putuka, and I will be talking to you about cancer today. Okay, why am I talking about cancer today? October month is well known for being Breast Cancer Awareness Month. So how am I going to go about with today's presentation? Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. And if we all recall, cancer is a chronic disease. So I will be talking, I will just be giving a general overview on cancer because I don't have enough time to talk to everything surrounding cancer. And I will also be briefly talking about breast cancer. As I have mentioned, October month is Breast Cancer Month. And breast cancer is actually one of the top 5 cancers that affect women in South Africa. And that is followed by cervical cancer, colorectal cancer, uterine cancer, and lung cancer. And research has shown that 1 in 25 women of all races are at risk of falling prey to this silent killer known as breast cancer. On a positive note, however, studies show that women who have an annual mammogram screening for breast cancer are diagnosed with less advanced cancer and smaller tumors. These women undergo less aggressive treatment and have a lower risk of death. Breast cancer accounted for more than a quarter of new cancer cases in South African women in 2020, and plus minus 8% of cancer deaths. I will also play a video that was aired on the 2nd of October to kickstart Breast Cancer Awareness Month. This video was played on SABC News, and it included an interview with Professor Jackie Smilg, who is the chairperson of the Breast Imaging Society of South Africa, talking about the effects of breast cancer. And since research has also shown that a regular breast self-examination plays an important role in discovering breast cancer compared to finding a breast lump by chance, I will end off my talk with a breast self-examination video. Now getting to today's session. What is cancer? Cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body. And remember, the human body is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division to form new cells as the body needs them. When cells grow old or become damaged, they die and new cells take their place. Sometimes this orderly process, does not happen. It breaks down and abnormal or damaged cells grow and multiply when they shouldn't be doing that. These cells may form tumors, which are lumps of tissue. Tumors can be cancerous or non-cancerous, which is also known as benign. Cancerous tumors spread into or invade nearby tissues and can travel to distant places in the body to form new tumors a process commonly known as metastasis. Cancerous tumors may also be called malignant tumors. Many cancers form solid tumors, but cancers of the blood, such as leukemias, do not generally do that. Benign tumors do not spread into or invade nearby tissues. When removed, benign tumors actually don't grow back, whereas cancerous tumors sometimes do. Benign tumors can sometimes be quite large, and some of the benign tumors can cause serious symptoms or can be life-threatening, such as benign tumors of the brain. Now let's get to differences between cancer cells and normal cells. Cancer cells differ from normal cells in many ways. For instance, cancer cells grow in the absence of signals telling them to grow. Normal cells only grow when they receive such signals. Cancer cells ignore signals that normally tell cells to stop dividing or to die, which is a process known as programmed cell death or apoptosis. Cancer cells invade into nearby areas and spread to other areas of the body. Normal cells stop growing when they encounter other cells, and most normal cells do not move around the body. Cancer cells tell blood vessels to grow towards tumors. These blood vessels end up supplying tumors with oxygen and nutrients, and they also remove waste products from the tumors, allowing them to grow. Cancer cells hide from the immune system. The immune system normally eliminates any damaged or abnormal cells. Cancer cells actually trick the immune system into helping them stay alive and grow. For instance, some cancer cells convince immune cells to protect the tumor instead of attacking it. Cancer cells accumulate multiple changes in their chromosomes, such as duplications and deletions of chromosome parts. Some cancer cells have double the normal number of chromosomes as opposed to normal cells. Finally, cancer cells rely on different kinds of nutrients than normal cells. In addition, some cancer cells make energy from nutrients in a different way than most normal cells. This allows the cancer cells to grow more quickly. Many times, cancer cells rely so heavily on these abnormal behaviors that I've just mentioned above, and they can't survive without them. Researchers have therefore taken advantage of this fact, ending up developing therapies that target the abnormal features of cancer cells. For example, some cancer therapies prevent blood vessels from growing towards the tumors, essentially starving the tumor of the needed nutrients. Now let's move on to signs and symptoms of cancer. Possible signs and symptoms of cancer include a lump. They may include abnormal bleeding. They may include prolonged cough. They may also include unexplained weight loss or a change in bowel movements. As you can see, while these symptoms may indicate cancer, they can also have other causes, so they are non-specific. And humans have more than 100 types of cancers. What are the risk factors of cancers? I'm sure you have heard about this many a times, but I am not going to stop sharing them because, as you will see as we present, they appear to be common amongst most of these chronic conditions that we share in our sessions. The number one risk factor is tobacco use. We know that the usage of tobacco is associated with most lung cancer, but it also causes cancer in the larynx, the voice box. It also causes cancer in the head, cancer in the neck, cancer in the stomach, cancer in the bladder, the kidneys, the esophagus, and the pancreas. Tobacco smoke contains over 50 known carcinogens, including nitrosamines and polycyclic aromatic hydrocarbons. And the other factor is that tobacco use is not only associated with cancer, but it is also associated with cancer deaths. Now, coming to obesity, excess body weight is associated with the development of many types of cancers and is also a factor in cancer deaths. Now, moving on to lack of physical activity. Physical activity is believed to contribute to cancer risk, not only through its effect on body weight, but also through negative effects on the immune system and the endocrine system. Poor diet. More than half of the effect from diet is due to eating too much rather than from eating too few vegetables or other healthful foods. Some specific foods are linked to specific cancers. For example, a diet that is high in salt is linked to gastric cancer. And we also have, a frequent food contaminant that is known as aflatoxin B1. That one is linked to liver cancer. We also have betel nut chewing that can cause oral cancer. Now let's talk about excessive drinking of alcohol. Regular heavy alcohol use can damage the liver, leading to inflammation and scarring, which might be why it raises the risk of liver cancer. Alcohol use has also been linked with a higher risk of colon cancer and cancer of the rectum. Ethanol is a type of alcohol that is found in alcoholic drinks, be it beer, be it wine, be it liquors, distilled spirits, or any alcohol drink. Alcohol drinks actually contain different percentages of ethanol. The amount of alcohol someone drinks over time, not the type of alcoholic beverage, seems to be the most important factor in raising cancer risk. Other risk factors include certain infections. For example, viruses are the usual infectious agents that cause cancer, but you also have bacteria and parasites that also play a role. And examples of viruses, I'm just going to mention a few. Looking at the time, we have hepatitis B and hepatitis C, which are associated with hepatocellular carcinoma. Bacterial infections, we have the Helicobacter pylori infection, which is associated with gastric carcinoma. And parasitic infections include schistosoma hematobium, which is associated with the cancer of the bladder. And then finally, amongst the risk factors, we have exposure to ionizing radiation. Radiation exposure such as ultraviolet radiation and radioactive material is a risk factor for cancer. Prolonged exposure to ultraviolet radiation from the sun can lead to melanoma and other skin malignancies. Clear evidence establishes ultraviolet radiation, especially non-ionizing medium wave ultraviolet light, as the cause of most common non-melanoma skin cancers, which are most common forms of the cancer in the world. Non-ionizing radiofrequency radiation from mobile phones, electric power transmissions, and other similar sources has been described as a possible carcinogen by the World Health Organization's International Agency for Research on Cancer. However, this has not been proved. So it's like it has not, no cases have been found to be consistent with this link of mobile phone radiation and cancer risk. Okay, finally, before we go to our videos, I'm just going to take you through treatment. We have 4 options of treatment: radiation therapy, surgery, chemotherapy, and targeted therapy. Radiation therapy is a therapy using ionizing radiation, generally provided as part of cancer treatment to control or kill malignant cells, and normally it's delivered by a linear accelerator. Radiation therapy may be curative in a number of types of cancers if they are localized to one area of the body. It may also be used as part of adjuvant therapy to prevent tumor recurrence after surgery, to remove a primary malignant tumor, for example, early stages of breast cancer. Radiation therapy is synergistic with chemotherapy and has been used before, during, and after chemotherapy in susceptible cancers. Now let's talk about surgery. There are many types of surgery. The types differ based on the purpose of the surgery, the part of the body that requires surgery, the amount of tissue to be removed, and in some cases, what the patient prefers. Surgery may be open or minimally invasive. Now, chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells. It usually works by keeping the cancer cells from growing, dividing, and making more cells. Because cancer cells usually grow and divide faster than normal, chemotherapy has been shown to be effective on treating cancer cells. Chemotherapy drugs may be used as one drug or in combination, for example, to attack cancer cells throughout the body or to target specific sites or processes. And what does chemotherapy do? Chemotherapy drugs prevent cell division, target the cancer cells' food source, for example, the enzymes and hormones they need to grow. They also trigger apoptosis or the suicide of cancer cells. And finally, targeted therapy is a type of cancer treatment that targets proteins that control how cancer cells grow, divide, and spread. Now, without wasting any time, I'm going to go on and play the video that I was referring to, which was aired on the 2nd of October. Sit back, relax, and enjoy.
Month, and studies show that women who have an annual mammogram screening for breast cancer are diagnosed with less advanced cancer and smaller tumors. The women undergo less aggressive treatment and have a lower risk of death. Breast cancer accounted for more than a quarter of new cancer cases in South African women in 2020 and 8% of cancer deaths. The Breast Imaging Society of South Africa stresses that the gold standard for detection of breast cancer remains the mammogram. Annual mammogram screenings in women aged 40 to 49 is highly recommended due to the faster speed at which tumors double in size in this age group. All right, joining us now via Zoom is Professor Jackie Smilk, the chairperson of the Breast Imaging Society of South Africa, to chat to us more about the effects of breast cancer. Professor, very good evening to you. Thank you so much for joining us, and a warm welcome to the Globe.
Good evening. Thank you very much.
All right, let's talk about the effects of breast cancer. I mean, is there enough awareness here in South Africa with regards to breast cancer?
I don't think there's ever enough awareness, and particularly in the last year, I think cancer generally has taken a back seat, but we have to always remember that cancer hasn't been in lockdown. Cancer has continued relentlessly over the last year, particularly, and with all the lockdowns, a lot of patients have been adversely affected by the lockdowns in terms of not accessing their annual screening. So certainly October month is the International Pink Month, where across the world we try and raise particular awareness in October, although it should be a year-round awareness for breast cancer. So we can never do enough on the awareness side because early detection is crucial for the disease.
And it's often been said, Professor, that women generally fear diagnosis because of the experience of chemotherapy and physical mutilation related to mastectomy. I mean, how do we navigate around that? How do we get women to be diagnosed so they know where they stand?
Obviously, there's always a stress associated with a cancer diagnosis, but in breast cancer, particularly if we can find that cancer very early on, even before symptoms may develop in the woman, there's very good chance of complete cure, 5-year cure from that cancer. There's less mutilating surgery that needs to be done, and it is very advantageous to find it very early. But just as a addendum, it's not only women that can get breast cancer, men also can get breast cancer. So we want to raise awareness in both men and women.
And how should interventions, promote early detection of breast cancer and better adherence to treatment?
Well, certainly the gold standard we feel is mammography. Mammography can find cancers before they are palpable, before they can be felt in the breast, and long before symptoms may develop. In the woman herself, we do advocate monthly breast self-examination so that the woman or man becomes aware of the normal findings in their own breasts, and they can take themselves off if they do alert themselves to some changes in the breast. But certainly, scientific data has shown that from the age of 40 onwards, women should present themselves for yearly screening because this is shown to be very advantageous.
Let's now talk about the structural barriers to intensive therapies. Who needs to remove these structural barriers? Is it the government? Is it, the non-governmental organizations dealing with breast cancer?
It's a team effort in breast cancer, both in the diagnosis and treatment. Many countries have national screening programs where they offer mammography on a regular basis to the population as a whole. Unfortunately, in South Africa, we don't have a national screening program. We have individual screening, though, where both in the private and the government sector, individual women can attend to get a mammogram. But we would hope to be able to raise awareness, particularly with the funding beneficiaries, the medical aids, of the value of annual mammography. Some medical aids still only will pay for a mammogram every 2 years or so, and they are not happy to pay for them under the age of 50. And that's something the scientific data has certainly shown should be done regularly, as I said, from the age of 40 on an annual basis.
And how then do we, embrace the burden of invasive treatments? Because I know that they're very imperatives, in the next steps in delivering better treatment.
So, the treatment of breast cancer is a multidisciplinary treatment. It involves possibly surgery. There's the use of radiation therapy. There's the use of oncology, medical drugs to treat the disease. And if we get it early, you often don't need all of those modalities to treat it. And each individual person will have individualized treatment according to the stage that she presents with.
Let's talk about the effects of living with breast cancer, well, especially for women. I know that, it varied physical, emotional, and psychological challenges due to enduring treatment.
No, absolutely. And that's why breast cancer involves a multidisciplinary team, not only the diagnosis, which is mainly done by radiology. We have pathology who looks at the specimen. And then, as I say, our colleagues from the surgical disciplines, the oncology disciplines, but we also involve the emotional support of the patient with social workers, psychologists that work with the patients, so that it's a team effort helping the woman through the treatment.
And, you know, these campaigns, these awareness campaigns, just how extensive are they insofar as making sure that there's early detection of breast cancer?
Well, it's an international initiative. October is Pink Month across the world. And in South Africa, particularly the Radiological Society with our subgroup, BISA, we work a lot with the media to try and raise awareness. Many of the NGOs in South Africa are very good at doing both print, visual, and social media campaigns during October to help promote the awareness of breast cancer. So I think we do quite a good job overall.
All right, Professor Jackie, lovely chatting to you. Thank you so much for joining us.
Thank you very much. Good evening.
That is Professor Jackie Smilk. She's the chairperson of the Breast Imaging Society of South Africa, chatting to us more about the effects of breast cancer.
Thank you for watching this video.
To lose belly fat after 40.
Now, I'll just end off with this. This one is just 1 minute and 32 seconds. It's just a video that shows women on how to do a breast self-examination. Before we conclude, I'll play the video. Need help.
Yeah.
Okay, now let's watch.
It might not be a lump. It might be puckering, dimpling, breast or nipple changes, swollen glands, or yes, it might be a lump. Breast cancer is the most common cancer among South African women. So it's important to examine your breasts on the same day every month, 7 to 10 days after your period. If you no longer have your period, choose a day that's easy to remember. To do a proper breast self-examination, follow these 3 easy steps. In front of a mirror, check for any visible breast changes in 4 different positions. First, with your arms at your sides, then overhead, then firmly pressing your hands on your hips, and lastly, bending forward. Lie down on your back with a pillow under your right shoulder and your right hand under your head. Starting below the collarbone, make small circles by pressing down, moving clockwise towards the nipple. Remember to check under the armpit. In the shower, check your breast with the soapy left hand and fingers, using the same technique as lying down. Always repeat these 3 steps on both sides. Tell your doctor if breast cancer runs in the family. After the age of 40, make sure you have a mammogram every year. Cancer care centers offer clinical exams by professional nurses. Early detection can save your life.
Well, I think there's no better way to end this presentation than to say screening is important, especially if you're 40 years and over, if you have a family history of breast cancer, and sorry about that. Sorry about that. So I was just saying screening is very important. So doing your breast self-examination regularly and going for mammograms. And if you have any abnormalities, please consult so that we can spare your life and your treatment may be less advanced. Your cancer may be less advanced with smaller tumors, and so that you may only undergo less aggressive treatment and have a lower risk of death. Thank you.